Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. Heather Tick, a leader in integrative medicine for over 3 decades, currently serving as a clinical associate professor at the University of Washington in the departments of family medicine and anesthesia and pain medicine. The first recipient of the prestigious Gunn-Loke Endowed Professorship of Integrative Pain Medicine, Dr. Tick incorporates functional medicine into her practice for effective strategic treatment and long-term results.
Thank you so much for joining us today, Dr. Tick.
Thank you. It's my pleasure.
Right off the stage, from delivering a very informative and inspiring keynote address to 1,000 like-minded individuals here at the A4M Spring Congress in Hollywood, what would you say would be your single most important message that you delivered this morning?
I think it's that we're on the verge of a scientific revolution in medicine. And this morning I quoted from Thomas Kuhn, his work is 50 years old. And yet it's as important today as it was 50 years ago when he described how it is that that science changes, because science gets very entrenched in a paradigm, and he's actually the one who coined the idea of paradigms and paradigm shift. And so we tend to think that somehow something really big happens and suddenly we're off in a different direction. And what he outlines is that that isn't how it happens. It happens a little bit at a time, but not with incremental movement in the system. So the system doesn't change a little bit at a time. The system's entrenched. It's dug its heels in. And it doesn't want to change. And the people who are members of that system think that what they know is how the world works. And they're right, and they're dogmatic. But then things that they can't explain come up through the science. And when enough of those things that are not explainable have come up through science, somebody within that group becomes an early adopter and says, maybe we should look at this. And it may take decades. And often it does. This organization's 25 years old, and look how far it's come, but still it's not mainstream yet.
So let's talk about your journey. What prompted your initial desire to go study medicine?
Well, for some reason I had always wanted to go into medicine. It just seemed very practical. It seemed like something that you could take with you when you went anywhere. You could practice anywhere. You could be really helpful to people. But also I had a skepticism about what I was hearing, and this was in my early teens in terms of medicine, how readily people use drugs. Even then, that was something that I was aware of, and I'm not even sure why, because I wasn't on any medications. But actually, I have to say, I had migraines early on, and one of the doctors had given me medications, and I thought, this is not good stuff. I don't like the effect of this on me. And so I had the skepticism, and I wanted to know. I wanted the education that would allow me to judge what was the predominant way that people are practicing, what the medical information was that I was getting, that my family members were getting. So that's where I started. And I took a detour and did a master's degree in English literature on the way, and I was on my way to do my PhD. And, life sends you messages. I got sick. Something that, could be transient, but it laid me up for a good 6 months. And that gave me time to just sit back and reevaluate and say, I think I'd rather talk to people about something practical like diarrhea rather than just be talking about these wonderful things I was learning about in English literature, but it wasn't grounded enough for me. I wanted something that was much more real and impactful in people's lives.
So what caused your personal paradigm shift from a conventional approach to an integrative approach?
Well, actually, it was that medical school was an intermission that was an anomaly. in my life, because I was always very aware of health and the importance of what you eat, drink, think, feel, and do. And then I went to medical school and became kind of comfortable with medications, came out into practice and thought, okay, I'm a conventional doctor and the drugs aren't so bad and we can use all these drugs. And then in the first year of my practice, something very odd happened. Two 26-year-olds, one was a friend and one was a patient, who were on the birth control pill, who were athletic, slim, low risk in every way that we could measure, developed strokes. Now, many of my colleagues have never seen one stroke from the birth control pill. I saw 2 in 1 year in my first year of practice. And that was just a slap upside the head, saying, you thought you're comfortable with all these drugs? Guess again. And so, I mean, I still treated fairly conventionally in that I wasn't sort of deeply informed about what all the alternatives were in terms of how does one utilize a lot of different kinds of supplements and herbs. But certainly I'd always taken supplements myself. I was juicing when I was 20. And I was, exercising, and I was meditating and doing yoga and doing all these things. They're just, I don't know, they were there. They were, programmed into my brain.
Who was your inspiration?
Well, I have to say that in terms of food, it was my mother. My family's European, and so she cooked every meal, and we all learned how to cook. And she made it very clear that we didn't buy processed foods. We rarely ate out. We would once in a while, but not much. And when somebody would say to me, why don't you bake a cake using a mix? I would look at them and I would parrot something back that I'd heard from my mother, which is it's full of chemicals. Except they weren't labeled in those days. How did she know? But she did. And so I have to say that was a really good grounding education for me, and I stuck with that one. And the rest of it, I think probably she was also an influence in that way, in terms of just taking care of herself in ways that are meaningful. Yeah.
So what prompted your desire to go into pain? Was it your own pain?
Yeah, it was my own pain. And when I look back on it, as I was going through it from childhood on, I didn't realize, I didn't name it. I mean, kids just accept what's going on in their lives as this is the fabric of your life. For me, I had episodes where they would be accompanied by pain, and I don't even remember if I told my parents about most of the things that were going on. Migraines did catch somebody's attention. But even then, I found out that how I eat makes a difference. And if I changed what I ate and made sure that I got enough sleep, I wouldn't get migraines, or I could manage them really easily. And so recognizing the influence of what I could do to impact pain, I think gave me a lot of empathy and understanding for what pain patients go through. And it was just a gradual evolution. I had a lot of patients with a CE, for patients with a TS, who have pain. And when that happens, all your colleagues send you all their chronic pain patients because they don't want to see them. Because as physicians, we don't like to do things we don't have an understanding of. In medical school, I can't even remember if my school had any direct pain education. But if you look at it even now, it's somewhere between 4 hours and 20 hours in medical schools. And actually it's 2 hours and 20 hours. And it kind of peaks at somewhere between 4 and 11 hours on pain in a whole 4-year education. That's outrageous when half or more of the patients who come to see us in general practice, in every practice, it's initiated by pain. And so in medical school, we spend 90% of our time studying what's going to help 5% of our patients. Nutrition which is the mainstay of my first interventions with people, that helps every single person I've ever seen in my entire practice. And I got 2 hours of education, formally. Of course, I've educated myself since leaving medical school and residency.
You had said, and I don't know if I'm quoting you or not, in your keynote, you said you didn't learn anything about healing in medical school.
That's true, too. So medical education teaches you about healing from acute things, like surgery, like a broken bone. You learn about how things heal. But when it comes to chronic conditions, you know, how often in medicine do the two words chronic and degenerative go together? All the time. And it's a huge nocebo. It depresses us as physicians because we kind of know we can't, well, we think we can't affect the course of this person's health. But we transmit that to the patient too. And so they think that they can't heal. For years we taught that cartilage doesn't heal. Well, why doesn't cartilage heal? It's now shown that it does heal. But we were intervening and starting to chop out bits of it long before we even gave it the chance to heal. And so we assumed that it couldn't. And so in general, when people come in with chronic diseases, we don't talk much about healing. And it's a huge mistake because we heal throughout our entire lives. I jokingly say that, you know, our hair keeps growing for 3 days after we die, so we must keep growing for about 3 days after they put us 6 feet under.
So your typical patient, what would be your standard of care?
Well, the first thing I do, and I think it's the first step in the relationship, is I actually go against the trend in medicine, which is to have a very short time to spend with them and to interrupt them with what I would think, what most physicians would think are salient questions, and the average is 16 seconds. And so I ask my patients either, how can I help you? Or tell me about yourself, what I need to know in order to be able to help you. And they start their story.
How much time do you spend?
It depends on, well, my first appointments are an hour long, so I'm very lucky that way and that I'm allowed that through the university. I let them talk, it depends on what they need. So sometimes it's just so clear that they've really not had the ability to get this whole story out that I let them talk, and it's cathartic. Other times there are people who you can tell they've rehearsed this story so many times and this is their identity. And there I may redirect them in different ways and ask them questions that they haven't been asked before, like, when was the last time you were well? And they always look at me puzzled, like, you know, why would you want to know? You're here to talk about pain and illness and sickness and disease. I said, no, I want to know how long, you know, sometimes that gives me clues into what happened or to clues into who you are and what makes you joyful, what is meaningful to you. And so very often the look on people's face will change and they'll remember what it was like when they were well. Or sometimes in very sad situations, they don't ever remember when they were well. If they had terrible, terrible childhoods, if there's a lot of abuse, abandonment, I mean, you can see an awful lot of pain. But again, at least it gives an insight into what I need to deal with.
Can you share a success story?
Well, yes. There's a young person who had a terribly abusive background. Parents were extraordinarily neglectful. She was abused. She was. I can't even go into the details of it, just because it's actually too horrendous. And she ended up on the street, addicted to drugs, and all that life that goes along with that at a very early age. And then somehow she got out of it. And she decided she was going to get some education. She developed a profession. She went to work. She ended up having a work-related injury. Now, by this time, she was also married, successfully married, and that's also very anomalous from that kind of a background. And she had an accident, she had an injury, and she had surgery. And after surgery, she never recovered well. Spine surgery is not a good thing in most cases. And she was high risk because of the background. And she came in to the clinic, she was being seen there, and she was on opioids and other medications that we use to modify pain. And she was trying to wean down off of the opioids, and we were helping her do that. Someone in the clinic was doing that, and they sent her to me to do some of the other things that I do. So I work with acupuncture needles, I work with nutrition, of course. And we started to work on this, and at one point, she was on like 15 drugs, and she's a young person. And opioids was the one thing they had targeted. And I looked at her and I thought, you know, I think you could probably stop a lot more of these drugs than what you're aiming at right now. So I'm not saying be in a rush, but I just bet you could, and I bet it'll make you healthier. And I treated her for a little while. She was doing quite well. Then she was off, just getting off of the opioids. She wasn't seeing me. And I saw her about a year and a half later, and she came in and said, "You don't know this, but you changed my life." And I said, "Tell me." And she said, it all happened when you said, you can stop all these drugs and you can have a healthier life. And she did. And she said, you know, I still have pain, but I have my personality back. I'm me again. I feel like a person. I don't feel like a zombie being on all these drugs.
So when that happens, what do you feel?
I'm even tearing up now. I mean, it's extremely emotional to do that, but I have to say that it probably happens, it's probably every week. Somebody comes in and says, what you did was life-changing. And all I'm doing is opening them up to new possibilities of what they can do for themselves. One of the analogies I like to use with really resistant people who are saying, you know, you're supposed to fix me, is like, you know, I wish it worked that way. I wish I had a magic pill. But if you went to the dentist twice a year and had a really good thorough cleaning, but never brushed your teeth, would you expect to have healthy teeth? And then they get it. We can't do for people what they won't do for themselves. And health doesn't come from drugs. Yes, there are life-saving drugs, and those aren't the ones I'm talking about. I'm talking about the ones that are there to treat symptoms that aren't really altering the course of a disease in any meaningful way. And those are the ones that we have to really minimize the use of.
Your colleagues
Yeah.
that you practice that in Washington, are they supportive of the manner of which you practice medicine? Have you received pushback?
Well, I'm 5 years in now. They're pretty supportive, which is really nice. When I tell the story of how I arrived there, I sort of say, well, in a fit of madness, they decided to hire an integrative physician, because at that point there wasn't anybody in an anesthesiology pain department at a major university, or any university, that had a fully integrative practitioner who was going to practice that way. And I don't even think they fully understood all of the facets of my work, and I don't even do everything that I know how to do. I used to be, I founded and co-directed an integrative pain clinic in Toronto for 15 years before I came to the US. And there we had all sorts of things. We had cold lasers, we had surface EMG, we had chiropractic, osteopathy, Reiki, we did energy therapies, movement therapies. We had everything. It was amazing. I'm working with much more limited tools within the university, but they are moving. I got a lot of pushback at the beginning from some of my
limited tools
colleagues.
Because of they haven't had their eyes opened yet to it, or financially?
The business model of medicine is very, very difficult to have change in. And in universities, it's even more difficult because they're under an awful lot of scrutiny. So there are certain things that I can introduce, and one by one I do, and I get them comfortable with the first thing that I'm doing, and then I get them comfortable with the next thing that I want to do. And so gradually we're getting there. And my hope is that I'll have people on a team. I'd love to have a naturopath in the clinic, somebody who does conventional acupuncture. I do a technique called intramuscular stimulation, which is utilized, it's using acupuncture needles, but it's utilizing them in a very different way, and that's was a technique pioneered by a man named Gunn, who's a physician, graduated from Cambridge in UK and came to work in Canada, which is where I met him and trained with him. And so I would love to have a whole team, chiropractors and osteopaths and other people who would help with the patient population.
So let's talk about you a little bit more personally, if we can. So over the course of your journey, what has brought you the greatest satisfaction?
Well, certainly seeing the light go on in people's eyes when they realize that they don't have to stay in the position that they're in. They're focused on pain. I'm focused on health. And they hadn't thought of that before, for the most part. They may have thought about it a little bit. You know, I do have to brush my teeth. I do have to eat my meals. Maybe I should get some sleep. But there are many gaps. You know, sleep is something that in North America we don't do very well. We don't deal with our stress very well. And that totally messes up your body chemistry, makes us much more inflamed. It interferes with digestion, with brain function, with hormones. And if all those pieces aren't in place properly, we don't have a feeling of well-being. So having them turned on to the issue that they could pursue health, that even though they're in pain, it isn't that they are pain with a little person. They are a whole person. And we need to delegate pain down here and get on with life. So that's a really satisfying thing.
Don't let that define them.
Don't let that define them. Exactly. Don't let pain define them. Yeah.
So how do you spend your time off?
Oh, well, I've been a terrible example during the 5 years I've been at the University of Washington, I have to say. I knew I was taking on a really big challenge because my goal was culture change. So I didn't want to just come and, you know, talk to a few people about nutrition and put them on vitamin D and magnesium, and that was all I did. I actually wanted to change their concept of what their health was and what their goal was. I wanted to have more influence on what the conversations were that my colleagues have with patients. And if they weren't going to have the conversation, at least send them to me, and I'll have the conversation. And so that's really happened. There has been a shift, and there are more people who are more open and spending more time on nutrition and movement and mind-body therapies in the clinic. I can't take sole responsibility for that, but there's, you know, from the time I arrived until what's going on now, there have been many, many, many shifts, and it's really wonderful to see. And so I knew I was taking on a lot. I knew there was going to be a lot of pushback. I had to do a ton of reading. I also, interestingly enough, had to change the way I speak. So I was in private practice, and I was gearing most of my communication towards patients, towards people. And even my writing, my books, they're designed for people. And I was at the University of Arizona before I came to Washington, but it was a different, there wasn't a department around me. I was the pain department down there at that point. And then when I came to Washington in this very academic center, I wasn't talking to people anymore. I was talking to academics. Not that they're not people, they are. But they interrogate things differently. And so I was coming in and I was giving them the evidence in the way that I was used to giving it. And I was being disregarded, and I couldn't figure this out. They didn't want to hear this from me. And so I looked at their speech patterns. I looked at how they do things. And so I started to talk faster. I started to talk with run-on sentences. I ignored punctuation. I peppered everything with references. I used a lot of technical words, sentence structure out the door. And they started to take me much more seriously. And it's interesting because I told this story when I was taking a course at Tufts University on interprofessional education and interprofessional collaboration. And I told this story there, and one of the participants, who's a non-physician, said, well, gee, didn't that make you feel diminished? And I thought about it, and I thought, no, but why would you? I need to understand why you would feel that way. And she talked about it, just feeling that she would feel like a second-class citizen. She would feel that she wasn't regarded and respected. And I thought about it, and then I realized that I have the privilege of being part of the ruling class. So I'm part of the paradigm, even though I am an outsider in many of my thoughts and ideas. I still have the MD, and that gives me a real advantage. And so I like to be careful of that and when I listen to other people talk who aren't part of the ruling class.
So now when you're speaking with your peers, mm-hmm. Are you speaking the way you initially would speak to your patients, as you mentioned, or are you still now peppering it with the science? No. Okay, so you haven't been able to.
I'm still speaking academic speak.
But even though you're now an authority in what you speak of and multiple books and whatnot, and you're still feeling like you have to walk on eggshells a little bit.
If you go to France, you speak French.
Right.
If you want them to understand you, you speak French. So that's the reality.
I started out, my question to you was, what do you do in your time off?
Oh, dear.
You don't have any time off.
Did I avoid that? I really haven't taken much time off. I do have the privilege of traveling. Sometimes I get invited to really nice places to speak. And so I'll take a little bit of time around those speaking opportunities. I have 3 wonderful kids. I like to go visit them and spend time with them. None of them are in Seattle right now. I love to listen to music. I like to watch movies. I don't do enough of any of that.
So what would you hope your legacy would be?
To have moved this a little bit forward, to have contributed in a little way towards shifting the paradigm and bringing people together. There are many silos in medicine. Certainly there are divisions between the different specialties. So one of my major areas is myofascial pain. That area is populated by many people in the CAM professions, the complementary, alternative, or integrative professions. But they don't speak to each other. So you have DOs and DCs, chiropractors, and you have massage therapists, physical therapists, movement therapists, doctors. They all speak a different language. And because they speak a different language, I think we're undermining the credibility of what the message is, and the message is that most people who are in pain have a component of pain that is myofascial. And it's easy to treat, and if you treat it, you make the whole picture better, and they can function better. So my next big project is actually to bring groups of people together among the different professions and get them to talk, and bring the researchers in as well. Because the different areas of research, they're way ahead of us. They know a lot of things before we will recognize them clinically from an academic standpoint. Though I have to say the practitioners are the furthest ahead. They're the ones who are on the ground. They see, they get the ideas, and they're the ones who really are the sources of ideas.
So if you weren't a physician, what would you be doing?
What would I be doing? My goodness. Right now, I'd love to be a beach bum.
Well, hopefully you can go to the beach after this.
Yeah. I would have loved to have an osteopathic training, and that still is one of the things on my bucket list. I want to go to some osteopathic courses and learn osteopathic manual medicine. I'd love to do that. I know what I'd be. What I love doing most of all is writing. So I'd be a writer.
Do you have a book in the works?
I always have several books in the works, but they're not near completion because I'm too busy doing all this other stuff. But I'm hoping that they'll get there.
You talked about how the food that you grew up eating was always cooked and and not processed and not chemical and whatnot. And it sounds like that you were kind of brought up as an old soul with those teachings. How did you bring up your children? Here you were a working mother. So did you cook for the family? Was it different?
I became the queen of the 20-minute preparation to prepare a dinner for anything from my nuclear family, which was 5, to 15 that we would have on certain, on Friday nights or on the weekend. And I just really developed a lot of shortcuts, a lot of planning around meals. My kids all learned how to cook. They all went through stages when they were in their teens when they kind of rebelled and wanted to eat junk food. And it's very gratifying that once they got into their 20s, they all started to eat healthy. They've learned how to cook. They cook some amazing things. Funny story, when my youngest son I think he was around 10 or 11, he came in and he said, "I want to make a jelly roll. How do I do that?" And I thought, oh, those are intimidating. I'm a baker. I've done lots of things. I've always been intimidated of that. I said, I don't know, but here's a recipe. Try it. He started to make these gorgeous jelly rolls. Of course, he would fill them with whipped cream because at the time we were eating dairy at home. Subsequently, most of us are dairy-free. But he mastered it. It was amazing. So there was a love of cooking. So yeah, we ate most of our meals at home.
So have you made any other dietary modifications in your life?
Oh yeah, I'm gluten-free, and I go grain-free much of the time. Not all the time, but most of the time I don't eat many grains. I don't react well to them, and I feel much better on the limitations to my diet. Yeah.
Is there anyone that you consider a mentor, or that you seek advice from?
Certainly Chan Gunn was a major mentor for me. There were some of my teachers in medical school who had the capacity to be truly present with their patients. They weren't distracted by trying to connect those dots that I talk about in medicine being a game of connect the dots, which the dots are the little bits of data like this blood test, this x-ray, this complaint. And then when you get enough of them together, you can say you have a diagnosis, and the diagnosis leaves out a lot of individual details. So that's what the problem is with diagnosis. But there were some of the doctors who would pay an awful lot of attention to that. There was one particular cardiologist whose name was Alan Tinmouth, who was there during my internship, and he had a big influence on me that way. And then the other people who inspired me and who were truly mentors were the patients who were thriving in the face of tremendous adversity. So in medicine, we usually ignore the outliers. The person who has a really good outcome, the person who thrives in spite of terrible looking tests and things, we say, oh, we can disregard that. We'll ignore that. We're just going to deal with what we really understand, which is the people who are fulfilling the description of chronic and degenerative. And I've always been attracted to those outliers. It's like, what do they know that we don't know? I want to learn that. I want to teach that to the rest of my patients. That's what I want to study. So those people really inspired me.
I think we'll end it right there. It's great. Thank you so much.
Thank you.